Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, we're talking about pediatric asthma. It's not a different disease from asthma in adults, but for children, it can cause unique challenges. Pediatric asthma is the primary reason for emergency room visits, hospitalization, and missed days from school. With proper treatment, though, your child can keep their symptoms under control and also prevent lung damage. Dr. Kevin Connelly is Medical Director, Pediatric ER at Henrico Doctors Hospital, and thanks again for joining us again. I want to start out with a question that sounds a little naive. What is asthma?
So asthma is a chronic lung condition, meaning that you have it for a long time, and it's repeated bouts of wheezing. Now, not everything that's wheezing is asthma, but asthma always has wheezing with it. A lot of things can cause wheezing, but asthma is a chronic problem within the lungs, causing chronic inflammation and swelling within the tubes of the lungs.
Why are we seeing more children with asthma?
There are a lot of reasons kids get asthma because there are a lot of triggers that can cause asthma. Pollen, being around cigarette smoke, the weather, all these things can trigger asthma attacks. And
what about the symptoms that a child experiences? Do they disappear as they become adults, or is this is lifetime?
It's typically more of a lifetime problem. It can improve as you get older or get worse. And asthma is something that's always there. A normal airway is like a normal hollow tube. But somebody that has asthma, that tube, the inside of the tube is swollen all the time. And when they have an asthma attack, the tube gets crunched down. So now you not only have the swelling within the tube, but the tube's smaller, and that causes air trapping, difficulty breathing, coughing, wheezing.
And talk about some of the props you brought with you today. These are some of the treatment options.
Exactly. So asthma, since it's caused by two things, both the swelling inside the tube and the constriction of the tube, there are medicines such as albuterol, which comes as an inhaler or a nebulizer you can do. For little kids, you can do something called a spacer. You put that on there, you squeeze it, you put it over the child's mouth, they breathe it in. You can carry it in your purse, you can go to school with it. It's a great option, and that gets rid of the tightness in their lungs. There are other medicines we use to get rid of the swelling and the edema in the lungs.
What is typically the reaction when you tell a parent your child has asthma?
I often get the question, does my child have asthma, even if they have their first time wheezing? Wheezing can happen for a lot of reasons. Allergies, viruses can cause it. Now, asthma is somebody that has wheezing over and over and over again. So once they realize that they have asthma and they can prevent some of the triggers that set it off, the child can have just a normal life.
So the symptoms there's no cure, but you can manage the symptoms.
Correct, that's exactly right.
Excellent. Dr. Connelly, thank you so much for joining us again.
You're welcome.